The impact of discussions between women about the menstrual period can actually cause a woman to think that she is having severe menstrual pain. Some is real, some is not. Another cause of dysmenorrhea can be the presence of an intrauterine device that is oftentimes used for contraception. Treatment of dysmenorrhea includes the use of nonsteroidal anti-inflammatory drugs because they have antiprostaglandin properties. The literature has demonstrated that high levels of prostaglandin that is located within the endometrial tissue causes uterine ischemia, hypoxia, and ultimately myometrial contraction, also known as cramps. Therefore, the NSAIDs are trying to block this effect. The instruction to the patient include to take the NSAIDs at the desired dose the minute the woman thinks the cramps are beginning. The dose is to be repeated every 6 to 8 hours depending on which type of NSAID is being used. The over-the-counter products are adequate to treat dysmenorrhea. Another treatment that is frequently used is oral contraceptive agents because they halt the entire ovulatory process. Any menstrual period that occurs while on birth control pills is due to the hormonal effects of the pill itself, but not that of the patient's own cycle. Additional treatments that can help with dysmenorrhea include either rest or exercise. The next issue related to menstruation is called abnormal uterine bleeding. Sometimes you will see it referred to as dysfunctional uterine bleeding. There are 3 types: menorrhagia, metrorrhagia, and menometrorrhagia. That's a mouthful. You can see the definitions of each on the slide. So the menorrhagia is excessive or prolonged menstrual flow. Metrorrhagia is bleeding in between cycles or intermenstrual bleeding. Menometrorrhagia is irregular and excessive bleeding. At some point in a woman's life, she will experience one of these abnormalities. Unfortunately, some women experience all 3. The diagnosis and treatment of these disorders depends on the patient's history and the risk factors, including their age, proximity to menopause, and use of contraceptives. If a woman is on oral contraceptives and misses a couple of pills and tries to make up the dosages, she will experience metrorrhagia, bleeding between cycles, due to the irregular nature of the hormones that she has taken in by mouth. An important point to remember is that anytime there is abnormal uterine bleeding, the initial step in the evaluation is to rule out pregnancy. If the patient is not pregnant, diagnostic tests may include endometrial biopsy, where a small instrument is actually placed inside the uterus through the cervix, and pieces of tissue are suctioned or scraped off and sent to the lab for pathological evaluation. Another diagnostic test is a transvaginal ultrasound. This can be used to see the width of the endometrial stripe, which is measuring the lining of the uterus, as well as the presence of intrauterine fibroids, intramural fibroids, or endometrial polyps. Treatment of these disorders is aimed at stopping the bleeding. Some women are given a 10-day course of Provera. Methylprogesterone acetate is the generic name. 10 milligrams is prescribed per day for 10 to 14 days. The purpose of this drug is to help mature the uterine lining so that it can be shed in a more normal fashion. Use of this medication also helps to resynchronize the hormone cycle. Once the endometrial lining is shed through the period, the estrogen and progesterone levels go back down to close to zero, and then FSH stimulates the entire cycle again. Some women require surgical intervention because the bleeding is so excessive. These women must be put under anesthesia and have a dilatation and curettage. You may have heard of this procedure known as a D and C. Not a capital D, capital N, capital C. It is a capital D, the and sign, and a capital C. I say this because nursing students and patients have a difficult time differentiating those sounds and terms. The D and C is both diagnostic and therapeutic in nature. The next disorder related to menstruation is endometriosis. With this disorder, endometrial tissue and glands implant throughout the pelvis. Now recall, endometrial tissue is only supposed to be inside the uterus. It is unknown how or why endometriosis occurs. If you click on the link below, you will be able to read about one of the treatment options for endometriosis. However, before doing that, focus on the picture in the lower right-hand corner. This is a view of inside the pelvis using a laparoscope. The uterus is off to the right. You can see dense adhesions along the edge of the uterine wall that extends out towards the fallopian tube. And then up at the upper left, you can see an endometriosis implant. These implants respond to hormones. So throughout the menstrual cycle, what's going on inside the uterus is also occurring within these endometriosis implants. So at the time of the menstrual cycle, these endometriosis implants bleed within themselves, and it causes profound pelvic pain. Problems associated with endometriosis include severe dysmenorrhea as well as infertility. When you refer back to the picture again and you see those adhesions, adhesions are scars. So therefore, this fallopian tube is not able to move as freely as is needed in order to capture an egg as it is released out of the ovary. Treatment of endometriosis is aimed at reducing pain through the use of nonsteroidal anti-inflammatory drugs and suppressing hormone cycles. So Lupron Depot, which is a GnRH agonist, is given to the woman. So once again, click on the link on the slide and you can read about how Lupron works. The unfortunate aspect of Lupron is it causes a woman to feel as though she is immediately in a menopausal state with all its signs and symptoms. The next issue related to menstruation is called premenstrual syndrome. You may have heard of it as PMS. It is widely talked about. What it is a constellation of signs and symptoms that a woman feels throughout the cycle, primarily closer to the menstrual period, that are very unpleasant. The symptoms occur during the luteal phase. In fact, in order to be diagnosed officially as PMS, a woman must be completely symptom-free for at least 7 days of the menstrual cycle. and typically that should occur during the first 7 days. Remember, day 0 starts when the period begins. Symptoms include irritability, mood swings, weight gain, abdominal bloating, acne can flare, and a woman can experience profound food cravings. The symptoms can be severe enough to alter a woman's quality of life and impact her activities of daily living. The etiology of PMS is unknown. Management is individualized and is based on addressing the symptoms that each woman is experiencing. The nurse's role is to encourage a woman to seek assistance from a healthcare practitioner that is knowledgeable about PMS. The nurse should also discourage self-diagnosis based on having a couple of symptoms on an occasional basis. Treatment options include taking a multivitamin with folic acid, taking calcium with vitamin D, the use of evening primrose oil, exercising, and most importantly, healthy eating. A woman needs to avoid salts and sugars during this period of time. A woman should be encouraged to get adequate rest, at least 7 to 8 hours during the night. In addition, for women who have a high-stress life, she needs to be given information about how to cope healthily with her stress. In addition, women who smoke should be encouraged to stop, as this increases the signs and symptoms of PMS. Some women are started on a monophasic oral contraceptive pill. On a monophasic pill, every single day has the same amount of hormone. Therefore, there are no hormone surges close to the time of the menses.